Hello guys, today we'll start a new topic called as pyelonephritis. So in this we'll discuss about pyelonephritis and also the difference between the cystitis. So if we talk about pyelonephritis, so as we know the pyelonephritis is one of the urinary tract infection. Is a urinary tract infection. So it affects the kidney and basically we see the major signs where the location of pain. First of all, you can find in the question that we are talking about like the Usmle one or the students who are studying like in the Mbbs foreign abroad. So in the question that comes in their exams. So what we see that the symptoms generally involves in startings. So we have like fever, and often this fever will be like more than 38 degrees Celsius. Then along with that we have the pain that will come with the flank pain, and this flank pain will be like at the side or back pain, usually at like one side of the pain we call as like sometime lumbar pain. So this pain will also be seen in your urolithiasis. We'll discuss about it later on. So the back pain usually at one side, this is flank and lumbar pain, will be on one side. This is you the hallmark of the question, that you can find answer from it if it is pyelonephritis or glomerulonephritis or other than this, because this is you can differentiate from urolithiasis. So we'll discuss it later on how to differentiate. Another we can see along with this the symptom that is general symptom, that the frequent painful urination. You can see the frequent painful urination. And in the question sometimes they ask about like cloudy or like foul smelling urine. This can be also be seen in the question. So we are generally talking about how the question that will come in the exam while doing the like your exams questions. And as we know that how it is caused, we talked about the symptoms, and generally as we know that the symptom that cause and risk factor. So in the causes and the risk factor, we can see that it is as it is like the infection is caused by the bacteria. So this bacteria will be like E. coli, which is like most often is there. And we can also see that it also be like sometime because of this pyelonephritis causes could be urinary tract infection, urinary tract obstruction, or there could be like infection is there. So kidney stones or enlarged prostate is one of the reason for this cause of pyelonephritis, enlarged prostate, and also like the kidney stones. So this is the kidney stones. And then we can say that what you can see other than this, as we know that we talk about the pain, and one of the hallmark feature we can see in this along with this. So we can see in this the hallmark feature of this, that will be the costovertebral angle is present, as we discussed that the pain in the lumbar area, and we also call as positive Pasternak signs. So this will be present. And also like placing the palm in the renal region, you can also find like sometime patient complaint of that I am having pain on the renal region. So you can do it from like the placing the palm in the region, placing palm in the renal region, and from that hitting the back, like the doctor the will do this, like they will hit on the back of the palm with fist, like with fist, and the patient will say that he feels pain, and this pain will be elicited. Now what we can see in the lab diagnosis, this is also one of the question that nowadays comes, that you can see the lab diagnosis. And this diagnosis could be like we have one of the hallmark feature of this, lymphocytosis will be increases. And we can also see that in the questions that it could be seen like single erythrocytes, not more than only one erythrocytes or two erythrocytes will be present sometimes in the questions. And along with also like turbid urine and bacteriuria is also present. So this you can also find in the questions. And later on we discuss about the medicine as compared to with like cystitis, because the questions that come, how do you differentiate with cystitis also, this is one of the easiest one that we can do from difference with like cystitis. So in the cystitis what we do, that as we know that the cystitis is an infection of bladder of lower urinary tract, infection of bladder with lower urinary tract. And then we can also see, let me check this what happened.